how long do soft tissue fillers last? This depends on which fillers are used and your own metabolism for those fillers. There are so many different kinds of fillers. There's ones that are super soft and they are for filling the teeny tiniest little lines, and you can go very superficial with them. However, because they are so soft, they tend to break down faster. These can last anywhere from 3 to 6 months. There are fillers that last 9 to 12 months. These are the ones that we use for things like the nasolabial folds, the lips, the marionette lines, the most common things that we fill. And then there are thicker, firmer fillers that we use for adding volume and from creating contour. These are things like Voluma or Restylane Lyft. These are things we use in the cheek and the jawline. And in some people, if their marionette lines are very deep, you can use those. Which fillers last the longest? Those last around 12 to 18 months. There's also Sculptura. This can last around 2 years. This is a different kind of a filler. It's polylactic acid that builds your own collagen. So that's a series of injections, and then it lasts longer. So you have actual collagen stimulation. There's also Radiesse. This is calcium hydroxyapatite. It's a different kind of filler in that it is closer to bone and the actual molecular makeup. So this is something that's great for cheeks and for jawline and things that really need a little bit more firmness to it. The only downside with that is there isn't a way to undo this if you don't love it. With all of the hyaluronic acid fillers, there is something that we can inject and it makes it go away within 48 hours. But the Radiesse is something that you should have an experienced injector injecting, because if you love it, it's there for 15 to 18 months. And if you don't love it, it's there for 15 to 18 months. The other thing that affects how long soft tissue fillers last is where you're injecting it. So areas that you don't move very much, say the nose, or even the glabella, things like that, they tend to last for a very long time. This can be a year or longer, but places that we move a lot, like the lips, the fine lines around the lips or the lips themselves, we just move them a lot. And there is a lot of vasculature here. So this can be around 6 months. So even the fillers that say 9 to 12 months, I will tell my patients, just be prepared. It could be closer to the 6 months, depending on how much you move your mouth and how much we talk and smile and laugh, and which are all really great things. So it really depends. Also, it can be up to your metabolism for these products. That doesn't always correlate with your just metabolism in general. So when I say metabolism, people say, oh, great, I work out a lot or I don't work out a lot. That can be a factor. And we do see people that work out a lot, they tend not to last as long, but that may or may not have anything to do with it, because it's more about that enzyme, the hyaluronidase enzyme, and how that is affecting the fillers. Are any soft tissue fillers permanent? There are some fillers that are permanent. Bellafill is one of these. They are little spherules that you can inject, and if you love it, it's permanent. If you don't love it, it's still permanent. So this is something that I would only do with an experienced injector that you know very well, and they know your face. They know exactly how much to put where. I would probably have them do one that's not permanent first to make sure you love the way that it looks before going to something that's permanent. It's probably just a bias, but I tend to see more people that are not as crazy about the permanent soft tissue fillers that want something done about them. And at that point, most of the time, there's not a whole lot you can do. So just make sure 100% that that's what you want to do before taking that plunge. What should I avoid after getting fillers? The thing to think about is you don't want to make any small bruises larger after getting fillers. You're not going to move the filler, you're not going to make it go to a different place, anything like that, but what you might have is a tiny little bruise that becomes then a big bruise. So I wouldn't work out for about 24 hours, would avoid things like aspirin, Advil, or anything that could thin your blood. In particular, I would do that before the fillers and the fillers for at least 24 hours. How long does it take for fillers to settle? It usually takes 2 or 3 days, up to a week, for fillers to totally settle in. Right after we inject, there is some swelling just from the process of injecting. This tends to get better throughout that day, but then you may see more swelling when you wake up the next morning just from laying flat. This can then usually goes down by that afternoon, but can take 2 or 3 days to go down, just depending on how much you swell. Then there is some settling for the next few days, and then about a week, you're at where you're gonna be. How much are soft tissue fillers? This varies depending on your injector, your location, the filler that you're using, how much filler you're using. So it's good to have a conversation with your injector before having anything injected, just so you have an idea what things are going to be. Most places will price their fillers by syringe. So ask what their price is per syringe and how many syringes that they anticipate using. In general, these can vary from $400 up to $1,200 to $1,400 per syringe. And if you're doing something like a liquid facelift, this can be 5 or 6 syringes. So that's just something to be prepared for before you have anything injected. Have questions? Would sincerely love to hear from you. Call or email anytime. Thanks for watching.